Well, I'd like to welcome you to the 92nd Annual Convention of the Association of County Commissions of Alabama. I'm very pleased to have all the officers of the Alabama Sheriff's Association. Our president, Derek Cunningham, is going to be part of our discussion today, along with Vice Presidents Ray Norris of Clark County and Jay Jones of Lee. And then we've got the immediate past president, Heath Taylor, with us as well. The legislature had to put its session back together with baling wire and bubble gum, just like we've been trying to hold county government together in the same way. But one of the positive things that came out of the end of the session was a budget line increasing revenue to the Department of Mental Health to run the stepping up programs in those counties that might be willing to consider those. And I know here in Montgomery County, Derek, you might have been, if not the first, among the first counties in Alabama to look at the Stepping Up initiative. And I wonder if you have any thoughts on that, because I know mental health issues inside the jail is a problem that we continue to wrestle with and to try to figure out some way to serve those inmates with mental conditions better, but also to try to manage the operation of the jail better as well.
You're right, Sunday. When Stepping Up first formed, I went to Washington with them and helped them to try to secure funding for the nationwide initiative. And so I've been a firm supporter of the Stepping Up campaign. It was great because it really just didn't look at just sheriffs. We had county commissioners with us as well. But it opened up everybody's eyes as to how mental health is affecting us as far as in our jails and in our communities. And so, that was a great opportunity. But at the same time, it showed us what we need to be focused on. And what we're really focused on is being able to divert those people instead of incarcerating them into our jails, being able to have a diversion center set up so that we can take those inmates or those people that are suffering from a mental health crisis and send them to a diversion place instead of bringing them to our jails. We're turning our jails into mental health hospitals, which is not a good thing because the majority of your staff is not trained to be able to deal with the person in the crisis mode. So what we've started doing is when we start talking about CIT training for law enforcement, I've probably had 60% of my jail staff as well as my deputies to go through the CIT training to get that crisis intervention training so that we're prepared in the event that we have to deal with the persons in crisis mode. We know how to deal with that person. We know how to talk with that person. But there's a lot of things that trigger a person that's already in a crisis mode. And we need to know what those things are so that we're prepared to be able not to do those things, to sit that person into a major crisis and to be able to handle that person and to be able to get the person the help that they need instead of bringing them to our jail and bringing a person in that's off their meds, has been off their meds, and we're trying to deal with a person that really just don't understand and don't know what he or she are doing because they've been off their meds for quite some time. So I would recommend anybody in every county to be able to look at what's going on with Stepping Up and to get educated on this situation. We're talking about mental health right now, but just think after this pandemic, people lost their jobs, people have lost their homes. You're talking about a mental health crisis. We're about to go into a mental health crisis down the road.
And I had not given any thought to that, but you are right. This is going to hit us right between the eyes if it hasn't already. I'd be interested, Ray, as it relates to mental health directly in a rural county. What kind of access to services do you have if you have persons come into your jail that are in mental health crisis?
We use our local mental health officials to come down and evaluate them, but our problem, Sonny, is we we're not having any luck getting beds to put them in, and it's gotten to the point that I have to agree to send a transport officer to pick one up at a facility before they'll agree to allow my probate judge to put another one in. Just in the last 24 months, I went from one transport officer to 5. That's how much the mental health impact has been on a county with only 29,000 people. The access we have to a hospital, to a mental health hospital bed, is almost zero. So it's gotten to the point, if I've got one that's in a crisis so bad that we have to put them somewhere for mental health, the probate judge has to agree for them to release one that we got somewhere else so we can get a bed. So I have to send one transport officer to pick up one before they'll agree to take another one. And that's just overflowing in my jail, because these people, when they get in these crises, are committing criminal acts that the municipalities put them in my jail for. And I'm not finding statewide beds to get them into the system. We're getting them evaluated and having a lot of hearings, but it's causing a lot of extra transporting on us small counties, because we're going a long ways to find a bed to put one in. And the state's really not helping our probate judge. So what I think's got to happen in the near future, because of what Derek just said is a true statement, we hadn't seen the mental health crisis that's fixing to come with all these people losing their personal stuff and mentally challenging situations with COVID. We're going to have to get the Probate Judge Association, the County Commission Association, the Sheriff's Association all in a room somewhere and get us all together.
Well, and the crisis and the things you've just described in Clark County is not just Clark County. It's my belief it's everywhere. One of our legislative priorities this year was to try to get money in the budget for more stepping up programs. But having the money in the budget doesn't mean anything. We've got to have advocates for it to encourage sheriffs to take a look at it, to encourage county commissioners to take a look at it, but because it is going to require some resources, it is going to require a willingness to try this as something that might just shave one of the bad corners off. It is not a solution to this program, this huge problem, and I don't know what the solution is. Jay or Heath, y'all have any additional comments on this or any ideas?
This is Heath. I mean, and this is just an obvious observation, but the state has closed all the beds. What Ray's talking about is, 10 years ago, there were 5,000 mental health beds in the state, and today there's less than 1,000. And so, just the sheer problem of, ultimately, we've got to get the state to open up some in-treatment facilities. When they closed all the beds, the trend went to outpatient treatment of mental patients and trying to make them stay on their medication as an outpatient basis. And it's just now, 10 years later, we're realizing that this is a huge problem and it hasn't worked. And so, now we don't have the beds to put them back in, and all of the people that's outpatient for mental health is becoming the criminal aspect in our county jails, and we're a default mental health facility because of the closing of all the beds from the state. And so I'm not sure that you're going to fix it without actually opening up physical beds to be able to put some of these people in an in-treatment facility instead of trying to do everything outpatient.
Yeah, Heath, this is Jay. I agree. You're absolutely right. The issue has been that we've gone in the wrong direction, or the state has, in regard to our ability to work toward dealing with the mental health issues. We've gone to the least common denominator, county jails, as has been mentioned by everyone, and that's a big problem. The jails and mental health issues are the shadow thought area, if you will, of people's conscience in the state. We don't like to have to think about those things because that's not something pleasant, and we'd rather deal with, economy and business and all these other things, which is absolutely something we need to do, of course, but this isn't going to go away anytime, ever. And it's just getting worse. And instead of working with the legislature and finding funding for treatment areas and treatment facilities, we've gone in the reverse direction. And that's never going to solve this problem as long as we continue in that vein. I know it's gotten more attention in recent years, but we can't let up on focusing on the issue of mental health, especially when it comes to our jail operations. And as Ray mentioned, in our rural areas, they are in particular area of need. That some of us areas that are more fortunate that have more resources, such as here in Lee County, and we fare a little bit better, but it doesn't mean the problem is any better. And certainly our rural counties are affected much more so than our counties with more resources.
Now, Sonny, and also in Montgomery County, we're in a larger county, but at the same time, when you start looking at as it relates to mental health, access to beds is something that we face a major challenge with, because once we get these orders from the probate, we have to confirm that there's a bed available before we can go out and pick somebody up and take them to the hospital. And that's not to mention the people that we encounter on the street on a daily basis, where if there's no beds available, the next thing you know, you're going to find that person coming to the jail, because now family members have resorted to having to sign warrants on their loved ones because there's no beds available for actions that they do at the house. And so now they're signing warrants to put these people in jail because they don't have beds available. So what we need to do is to at least sit down with mental health and come up with some alternatives, because right now we're hurting until they open up some beds.
Yeah. Sonny, one of the biggest things that I'm seeing, and then I'll get off this mental health kick, is I didn't realize the cost of these shots that some of our mental health patients are getting as outpatients. And when they miss their shot, getting off of it is hard for them. I mean, it's a big problem. And as soon as one of these municipalities or one of my guys put them in my jail, my medical contract company immediately contacts me and says, hey, he hadn't had his shot. We've got to administer it. Well, you're talking about thousands of dollars. You're not talking about hundreds to get him back on track with the shot. So the medical cost end of mental health is killing us. And so we got to get with y'all somewhere and figure out how that his Medicare, Medicaid's going to cover it when he's in there, just like it does when he's on the street. I mean, we got to figure it out, because it's taking us out medically. I'm actually meeting with my medical providers this week to see if what they would charge me to provide some kind of mental health assistance in the jail, just evaluating and helping, so I know what I'm dealing with.
Well, I had a conversation about that very issue, the medication, with the Lee County probate judge, and Judge English. He had an idea of how to under the circumstances you've just described, to be able to get that shot administered without having the person to have to go through what has to be trauma for them as well, to being arrested and held in the jail. And so that's one thing I've put on my to-do list, to circle back to him as we look and get ready for the 2021 session. That may be something we can collectively work on together, if the idea is one that can work. And Jay, I know that you work very closely with Judge English. Just help me remember as we get ready to prepare for the 2021 session of the legislature that we try to address that. I know the House leadership has this issue of mental health care in the state on top of the table, and I think they'll be very receptive to hearing that from us.